Colon cancer kills over 52,000 Americans every single year. That's more than 140 people dying every day from a disease that is highly treatable when caught early. According to the American Cancer Society, colon cancer is the third most common cancer diagnosed in both men and women in the United States, with approximately 150,000 new cases diagnosed annually. What makes these statistics even more tragic is that colon cancer is one of the most preventable cancers. When detected at early stages through screening or recognition of warning signs, the 5-year survival rate exceeds 90%. But when diagnosed at advanced stages after the cancer has spread to distant organs, survival rates drop dramatically to below 15%. The problem is that most people ignore early warning signs for months or even years. They dismiss symptoms as hemorrhoids, irritable bowel syndrome, or normal aging changes. They feel embarrassed to discuss bowel habits with their doctor. They convince themselves that persistent symptoms will eventually resolve on their own. By the time they finally seek medical attention, the cancer has often progressed to advanced stages, requiring aggressive treatment with much lower cure rates. Research published in the Journal of the American Medical Association examined why colon cancer is frequently diagnosed at late stages. Studies found that in over 60% of cases, patients experienced warning symptoms for 6 months to 2 years before diagnosis. They noticed the symptoms but didn't recognize them as serious or didn't act on them quickly enough. This delay in diagnosis is the difference between a curable early-stage cancer and a terminal advanced-stage cancer. In this video, we'll examine 12 early warning signs of colon cancer that you should never ignore after age 60. Number 7 is so subtle that most people experience it for years without ever connecting it to their colon. These signs appear before the cancer becomes advanced when treatment is most effective and cure is most likely. Before we begin, understand that experiencing one or two of these symptoms doesn't necessarily mean you have cancer. Many conditions cause similar symptoms, but persistent symptoms lasting more than 2 weeks warrant medical evaluation, including colonoscopy. Early detection saves lives. Now, let's examine the warning signs your body sends when colon cancer is developing. Sign number 12. Changes in bowel movement frequency lasting more than 2 weeks. Starting with one of the earliest and most common symptoms, persistent changes in how often you have bowel movements can indicate colon cancer developing. Here's why this happens and what to watch for. Normal bowel movement frequency varies widely between individuals. Some healthy people have 3 bowel movements daily while others have 3 per week. What matters is your normal baseline pattern established over years. When colon cancer develops, it disrupts normal bowel function through several mechanisms. A growing tumor physically obstructs the colon, narrowing the passage through which stool travels. This obstruction slows transit time, causing constipation. The tumor also irritates the colon lining, triggering increased muscle contractions and more frequent bowel movements or diarrhea. Additionally, the cancer can secrete substances that affect gut motility and fluid absorption. Research from the British Journal of Cancer examined bowel habit changes in colon cancer patients before diagnosis. Studies found that 60% of patients experienced persistent changes in bowel frequency for an average of 8 months before diagnosis. Those with right-sided colon cancers in the ascending colon more commonly develop diarrhea with increased frequency. Those with left-sided cancers in the descending colon and sigmoid more commonly experienced constipation with decreased frequency. What makes this symptom significant is persistence. Temporary changes in bowel habits from dietary changes, stress, travel, or minor illnesses are normal and resolve within days. But changes persisting more than 2 weeks without obvious explanation warrant medical evaluation. If you normally have 1 bowel movement daily and suddenly you're having 3 or 4 daily for weeks, this requires colonoscopy. If you normally have daily movements and now you're going every 3 or 4 days for weeks, this also needs evaluation. The key is knowing your baseline and recognizing persistent deviations. Keep track of bowel movement frequency in a diary or smartphone app. If patterns change and persist beyond 2 weeks, schedule an appointment with your doctor and specifically mention this symptom. Don't dismiss it as aging or diet. Persistent change means something has changed in your colon and that something could be cancer growing. Sign number 11, narrow stools that look like pencils or ribbons. Moving to a very specific warning sign, stools that are consistently much thinner than normal can indicate a tumor partially obstructing your colon. Here's the mechanism and why you shouldn't ignore this symptom. Normal stool diameter varies, but typically measures 1 to 2 inches across. The shape reflects the diameter of your colon at its narrowest point, usually the sigmoid colon, just before the rectum. When a tumor grows inside the colon, it takes up space within the colon lumen, the hollow center through which stool passes. As the tumor enlarges, it progressively narrows the passage. Stool must squeeze through this narrowed segment, emerging thinner than normal. The appearance is described as pencil-thin ribbon, like or string, like stools. Research published in Gastroenterology examined stool caliber changes in colon cancer. Studies using colonoscopy found that 40% of patients with left-sided colon cancers, particularly in the sigmoid colon and rectum, experienced persistent thin stools for months before diagnosis. The narrowing correlates with tumor size. Small early tumors may not narrow stools noticeably, but as tumors grow larger, progressive narrowing occurs. What makes thin stools particularly concerning is that this symptom indicates the tumor has grown large enough to significantly obstruct the colon. This typically means the cancer is not at the earliest stage, but has been growing for months or years. However, it often still remains confined to the colon wall without distant spread, meaning it's potentially curable with surgery if diagnosed promptly. The key is consistency and persistence. Occasionally having one thin stool is not concerning, especially if you're having diarrhea or your diet changed. But consistently, thin stools every time you have a bowel movement for more than a week requires immediate medical evaluation. Don't wait weeks or months. This symptom indicates significant obstruction developing. Schedule colonoscopy urgently because the tumor causing this narrowing is large and needs removal. Sign number 10, blood in stool, either visible or detected by testing. Blood in your stool is one of the most important warning signs of colon cancer and should never be ignored. Here's what you need to know about this symptom. Colon cancer bleeds because tumors have abnormal, fragile blood vessels on their surface. As stool passes over the tumor, it traumatizes these vessels, causing bleeding. The blood then mixes with stool, appearing as bright red blood coating the outside of stool, dark maroon blood mixed throughout stool, or occult hidden blood not visible but detectable with chemicals. Testing, the appearance of blood depends on tumor location. Right-sided colon cancers in the cecum and ascending colon typically cause occult bleeding. The blood mixes with stool high in the colon and travels a long distance before exiting, during which bacteria break down the blood, making it dark and invisible. Left-sided cancers in the descending colon, sigmoid, and rectum more commonly cause visible bright red or maroon blood because the tumor is closer to the anus with less time for blood breakdown. Research from the Annals of Internal Medicine examined rectal bleeding in colon cancer patients. Studies found that 58% of patients with colon cancer experienced some form of bleeding before diagnosis, either visible blood noticed in toilet or on tissue, or occult blood detected by fecal immunochemical testing. Among those with visible bleeding, 72% attributed it to hemorrhoids and delayed seeking medical attention for an average of 9 months. What makes blood in stool particularly dangerous is that people dismiss it. They assume they have hemorrhoids without getting evaluated. While hemorrhoids are the most common cause of rectal bleeding, colon cancer must be ruled out through colonoscopy, especially in people over 60. The consequences of assuming it's hemorrhoids when it's actually cancer are catastrophic. The key is that any blood in stool after age 60 warrants colonoscopy, regardless of whether you think you have hemorrhoids. Even if you do have hemorrhoids, you could also have colon cancer. The two conditions commonly coexist. Don't rely on color to determine cause. Bright red blood doesn't necessarily mean hemorrhoids. Maroon or dark blood doesn't necessarily mean upper GI source. Get colonoscopy to visualize your entire colon and definitively rule out cancer. If you see blood in your stool even once, schedule an appointment with your doctor immediately. If you've never had a colonoscopy or your last one was more than 5 years ago, insist on colonoscopy now. Additionally, consider annual fecal immunochemical testing to detect occult blood you can't see. This simple stool test can detect hidden blood from cancers too small to cause visible bleeding. Sign number 9, persistent abdominal cramping or pain in one specific area. Abdominal pain or cramping that persists in one location can indicate colon cancer. Here's why this occurs and what patterns to recognize. The colon itself has few pain nerves. Early small colon cancers typically don't cause pain. But as tumors grow larger, they can cause pain through several mechanisms. Partial obstruction from tumor narrowing the colon causes cramping pain as the colon muscle contracts, forcefully trying to push stool through the narrowed segment. Tumor stretching the colon wall activates stretch receptors. Inflammation around the tumor irritates surrounding tissues. The pain location provides clues about tumor location. Right upper quadrant pain near the liver suggests ascending colon cancer. Central or periumbilical pain around the belly button suggests transverse colon cancer. Left lower quadrant pain in the lower left abdomen suggests descending or sigmoid cancer. Lower abdominal or pelvic pain suggests rectal cancer. Research from the American Journal of Gastroenterology examined abdominal pain patterns in colon cancer. Studies found that 44% of patients experienced persistent abdominal pain or cramping for an average of 6 months before diagnosis. The pain was typically described as cramping, occurring intermittently initially, then becoming more constant as the tumor grew. Pain often worsened after eating, as food and subsequent stool production increased pressure against the obstructed segment. What makes abdominal pain concerning is persistence and progressive worsening. Everyone experiences occasional cramping from gas, indigestion, or dietary indiscretion. These pains resolve within hours or days. But pain occurring repeatedly in the same location, gradually increasing in frequency and severity over weeks to months, indicates something structurally wrong in that area of the colon. The key is not ignoring persistent pain. If you have abdominal cramping or discomfort in one specific area occurring multiple times weekly for more than 2 weeks, This warrants medical evaluation. Describe the location, character, timing, and any associated symptoms like changes in bowel habits or blood in stool. Your doctor should perform a physical examination, and colonoscopy should be strongly considered, especially if you're over 60 or have other warning symptoms. Sign number 8. Unexplained iron deficiency, anemia causing fatigue. Iron deficiency anemia is often the first detectable sign of colon cancer, appearing on routine blood tests before any symptoms develop. Here's how colon cancer causes anemia and why this matters. Colon cancers bleed chronically from their abnormal fragile blood vessels. Right-sided colon cancers in particular cause slow, persistent bleeding. The blood loss is often occult, hidden in stool, and not visible. Each bowel movement loses a small amount of blood. Over months, this chronic blood loss depletes your iron stores and causes iron deficiency anemia. Anemia means your red blood cell count and hemoglobin levels drop below normal. With fewer red blood cells carrying oxygen, every cell in your body becomes oxygen-starved. This causes profound fatigue, weakness, shortness of breath with minimal exertion, rapid heart rate as your heart works harder to circulate the reduced red blood cells, and pale skin, particularly noticeable in nail beds and inner lower eyelids. Research from the Journal of Clinical Oncology examined iron deficiency anemia in colon cancer diagnosis. Studies found that 11% of men and 6% of women over age 60 who were diagnosed with iron deficiency anemia on routine blood testing were subsequently found to have colon cancer when properly evaluated. With colonoscopy, the anemia was the only abnormal finding in many cases, with no gastrointestinal symptoms reported initially. What makes anemia particularly valuable as a warning sign is that it's objectively measurable through simple blood tests. Complete blood count measuring hemoglobin, hematocrit, and red blood cell indices is routine in annual physical exams. When results show anemia, particularly microcytic anemia with small red blood cells indicating iron deficiency, the cause must be identified. In men and post, menopausal women over 60, iron deficiency anemia should be considered colon cancer until proven otherwise. The most common cause in this population is chronic gastrointestinal bleeding from colon cancer or other GI lesions. Don't accept iron supplements as treatment without first identifying and treating the underlying cause. Iron supplements will temporarily improve your blood counts, but won't stop a cancer from growing and spreading while the cause remains undiagnosed. The key is that unexplained iron deficiency anemia in anyone over 60 requires colonoscopy to examine the entire colon for bleeding sources. Sign number 7, feeling that bowel movements are incomplete. This is the subtle symptom that most people experience for years without recognizing its significance. Persistent feeling of incomplete evacuation after bowel movements can indicate rectal or sigmoid colon cancer. Here's the mechanism. When a tumor grows in the rectum or lower sigmoid colon, it creates a mass that your body perceives as stool remaining in the rectum. Stretch receptors in the rectal wall detect this mass and send signals to your brain indicating the rectum is full and needs emptying. You feel a constant urge to defecate even immediately after having a bowel movement. This symptom is called tenesmus in medical terminology. You feel like you need to pass stool, but when you try, either nothing comes out or you pass only a small amount of mucus or blood. The sensation is frustrating and distressing. You make multiple trips to the bathroom throughout the day trying to empty your rectum completely, but the feeling never fully resolves. Research from diseases of the colon and rectum examined tenesmus in colorectal cancer patients. Studies found that 35% of patients with rectal cancer and 18% of patients with sigmoid colon cancer experienced persistent tenesmus for an average of 11 months before diagnosis. Many patients mention this symptom to their doctors, but it was often attributed to hemorrhoids, constipation, or irritable bowel syndrome without further investigation. Sign number 6. Persistent nausea or vomiting without other explanation. Unexplained nausea and vomiting can indicate advanced colon obstruction from a large tumor. Here's how this develops. As a colon cancer grows, it progressively narrows the colon lumen. Initially, stool can still pass through the narrowed segment, causing the symptoms we've discussed, but eventually the obstruction becomes so severe that stool cannot pass effectively. Stool backs up behind the obstruction, filling the colon. This causes increased pressure, distension, and nausea. Additionally, complete or near complete obstruction prevents normal forward movement of intestinal contents. Food and fluid you swallow cannot progress through the system normally. This causes nausea, vomiting, and inability to tolerate food by mouth. The vomiting may become feculent, smelling like stool because intestinal contents are backing up so severely. Research from the American Journal of Surgery examined bowel obstruction in colon cancer. Studies found that 8 to 15% of colon cancer patients present with bowel obstruction as their first symptom. These cases represent more advanced cancers that have grown large enough to nearly or completely block the colon. However, most patients with obstruction had preceding warning symptoms, including constipation, cramping, and bloating that they ignored for months. Sign number 5, unintentional weight loss exceeding 5 pounds in 1 month. Losing weight without trying through diet or increased exercise is a red flag for cancer. Here's why colon cancer causes weight loss. Advanced colon cancers are metabolically active, consuming substantial calories. The tumor essentially steals nutrients from your body to fuel its growth. Additionally, cancer releases cytokines and other substances that suppress appetite, increase metabolism, and cause muscle and fat wasting called cachexia. You eat less while your body burns through energy stores faster. Colon obstruction from a large tumor can also cause weight loss by preventing adequate food intake. When you eat, you feel full quickly, nauseated, or develop cramping. So you eat less to avoid these symptoms. Over weeks and months, caloric deficit leads to progressive weight loss. Research from cancer examined weight loss in colorectal cancer patients. Studies found that 35% of patients experienced unintentional weight loss, averaging 12 pounds over 3 to 6 months before diagnosis. Weight loss was more common in right-sided colon cancers and more advanced stage cancers. What makes weight loss particularly concerning is that it indicates the cancer has been present long enough and is advanced enough to cause systemic metabolic effects. This typically means at least several months of tumor growth, and often indicates locally advanced or metastatic disease. The key is not ignoring unintentional weight loss. If you lose more than 5 pounds in 1 month or more than 10 pounds over 3 months without deliberately trying to lose weight through diet and exercise changes, this requires comprehensive evaluation, including colonoscopy if you're over 60. Weight loss plus any gastrointestinal symptoms makes colon cancer highly likely and demands immediate investigation. Sign number 4, persistent bloating or abdominal distension. Constant feeling of bloating or visible abdominal swelling can indicate colon cancer. Here's the mechanism. Partial obstruction from a tumor slows transit time through the colon. Stool and gas accumulate behind the obstruction, causing distension. The colon stretches to accommodate the backed-up contents, creating bloating sensation and visible abdominal swelling. Additionally, colon cancers can secrete fluid into the colon lumen, adding to distension. Some cancers trigger inflammatory responses, causing fluid accumulation in the abdominal cavity, called ascites, particularly if the cancer has spread to the peritoneum or liver. Sign number 3, chronic fatigue not explained by sleep or activity. Overwhelming fatigue that doesn't improve with rest can indicate colon cancer through multiple mechanisms. Anemia from chronic bleeding causes fatigue, as we discussed, but cancer also causes fatigue through inflammatory cytokines, disrupted metabolism, and cachexia muscle wasting. Research shows 60% of colon cancer patients experience significant fatigue before diagnosis. Combined with other symptoms, fatigue should prompt evaluation. The key is that cancer fatigue is profound, constant, and disproportionate to activity level. Sign number 2, new onset constipation in someone with previously normal bowel habits. Developing constipation for the first time after age 60 requires investigation. Left-sided colon cancers commonly cause progressive constipation as the tumor narrows the passage. Research shows new constipation persisting more than 2 weeks warrants colonoscopy. Sign number 1, family history of colon cancer, especially in first-degree relatives. While not a symptom, having a parent or sibling with colon cancer increases your risk fourfold. With family history, start screening at age 40 or 10 years before the age your relative was diagnosed. Don't wait until symptoms develop. If you recognize multiple symptoms from this list, schedule colonoscopy immediately. Early detection when cancer is confined to the colon wall means over 90% cure rate with surgery. Delayed diagnosis reduces survival dramatically. Which symptom surprised you most? Share in comments and subscribe for more life-saving health.